The first ever Health Equity Summit, organized by the VI Department of Health, brought together medical, health, and insurance partners from across the USVI to discuss the root causes of healthcare disparity and to find solutions that could improve the mortality rate in the territory. According to 2020 data shared at the summit, heart disease, cancer, Alzheimer's disease, diabetes, and assault or homicide were the leading causes of death in the USVI. Dr. Lena Fredericks, the Health Department's Territorial Director of Chronic Diseases, said that cases of heart disease were being driven by skyrocketing rates of high cholesterol among relatively young segments of the population.
Looking at hypertension prevalence, in the USVI, our prevalence is at 31.3, which is pretty comparable to the US. We're a little bit lower. By gender, females have higher prevalence, and this is a trend. I don't know if anybody picked up on it, but so far, females have been having higher prevalence. And then looking at it, hypertension by race and ethnicity, persons of other race had the highest prevalence, followed by white people, and then Hispanics and blacks. However, this is what was one of the most things that was shocking for me, because the prevalence of high cholesterol among this age group and this age group, 18 to 24 and 25 to 34, I think that's pretty alarming. And it shows why heart disease is the #1 killer in the territory.
As the summit's name implies, the focus was on improving equity in the sector, as health inequity prevents many people from accessing the health services that they need. The discussions at the summit showed that inequity can be related to a number of factors, including education, policy, and income level. University of the Virgin Islands Director Dr. Noreen Michael said that accessing quality healthcare correlates to education and income levels.
Diabetes, we know that there's an inverse relationship. So if your educational level is lower, particularly we saw that individuals without a high school diploma, their prevalence of diabetes is 32.2% compared to 14.9%, so double that of the general population if you do not have a high school diploma. Heart attacks, again, although, so it's a disparity, we're worse off than the US. We're not as badly off with heart attacks. However, one of the things we see, again, an inverse relationship based on both educational level as well as income level. So persons earning between $15,000 and $24,999, 11.9% prevalence compared to just the general public in the U.S. Virgin Islands.
It does not help that almost 12% of the USVI population lives below the poverty line, which reduces their access to medical resources. Two of the panelists at Monday's summit addressed federal issues that have systematically hampered access to proper health services in the territory.
When we talk about on the federal level, youths in the territories are at an even more disadvantage, because even from the previous administration, where we have changed priorities from primary prevention that really impacts youths to this secondary and tertiary model, which some are users or some have these experiences and we need to pull them back. But the majority are really to impact, we have to use primary prevention. And those funding are no more available. They're gone. And then for the territories are at an even more disadvantage, because our federal funders don't see territories, and not Virgin Islands, but territories on a whole, don't see territories as geographic priority areas. And that's a major problem that's affecting equity for all demographics, but especially for the demographic youth that we serve.
That it's really important that we pay attention to our federal laws and how the Virgin Islands is treated. I think a lot of times we think that we're not getting the care or not getting the access, but a lot of that has to do with our colonial aspect and the treatment that we receive from the United States. And it sounds real power to the people, but I am really on that. And it really is important. And we're at a place where we are losing the heart of our community due to a lack of resources because we're not treated equitably as a community by the United States of America.
The department plans to roll out a program to therefore support existing initiatives and introduce new methods to achieve healthcare that are inclusive and equitable for all Virgin Islanders. For example, by June of next year, the department wants to reduce obesity among African American and Hispanic women in the USVI from 35.6% to 34% by implementing the Eat Healthy, Be Active Community Workshop program. This demographic is at the highest risk for obesity in the territory.